Let's talk about culture and sensitivity tests. This always confused me in nursing school, so let me explain. A culture is identifying the type of germ or infection. You can remember this by the memory trick, culture think collecting data. We are collecting the type of germ or infection. Let's look at how this process goes. So first, we want to swab the infected area for a sample. This could be skin or body fluid such as blood, saliva, and tissue. Then you want to place the infectious material on a culture plate, which looks like this. Then we want to allow time for the bacteria to grow. Now, how do we interpret this? If germ growth is present, this is a positive culture. We have germs present. But if there are no germ growth, it will be a negative culture. So again, culture think collecting data. Now for our sensitivity test. This helps identify the type of medication that needs to be given to treat or eradicate the infection. So sensitivity tests think searching for the correct medication. So basically we want to find the correct medication to eradicate this infection. All right, how do we find this out? Well, we look at the bacteria we cultured under a microscope. Then we're going to test different antibiotics to see what will work best for that specific infection. Now, how do we interpret this? Let me zoom in on this because it's important. So as you can see, the areas that have no growth around the drop, this means that the bacteria is sensitive to that antibiotic, so we can use it to fight the infection. But as you can see here, the areas that have growth mean that the bacteria are not sensitive to that antibiotic, meaning it won't work. We want to stop the infection. So if they give the antibiotic and it's still growing, obviously we don't want to use that antibiotic. Okay, now a huge NCLEX alert for culture and sensitivity. You always want to obtain these cultures before administering an antibiotic. If you need help understanding and not just memorizing in nursing school, you should grab the Complete Nursing School bundle. It has help for fundamentals class, mental health class, mother-baby class, pediatrics class, med-surg, and pharmacology. You can grab this on my shop, Nurse in the Making. Happy studying, future nurses.